How do you use a spacer with a preventer inhaler? This is a good question. It's really important. I've started only ever prescribing these type of pressurized metered dose inhalers with a spacer because they massively, and I mean massively, improve the efficacy of the medication because you're getting more of it delivered directly into the lungs rather than it just getting stuck on your roof of your mouth, on your tongue, at the back of your throat, etc. The first thing that you want to do is have a look at the dose counter, which is usually on the back of the inhaler. This has got 190 puffs left, so that's ideal. The second thing is you take the canister out and then have a look at the expiry date. So this expires in April 2026. So again, it's in date, which means that it's going to work. Put it back in, remove the cap, give it a really, 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 really good shake, and then put it into the back of the spacer. It can be a bit of a tight fit, but that's necessary because we need to make sure there's a nice tight seal around the mouthpiece of the inhaler. Then we're just going to remove the cap from the spacer, and this is what it should look like. Inside here, there is a filter and there is a whistle. If you breathe in too hard, this will whistle. This is the sound it will make. That means you're breathing in too hard. You don't want it to be whistling. That's a bad sound. You want it to be quiet as you're breathing in. When you breathe out, you also want to be breathing out through your mouth. Because of the filter, it's going to make it difficult for you to breathe out, which means that that medication and that inhaled air is going to sit in your lungs for as long as it possibly can. When you take your inhale, you want to take a nice, slow, deep breath. Some people sometimes struggle with this. Don't worry too much, but just go as deep as you can possibly go. With a preventer, it should be easier. But if you're using a reliever inhaler, so a blue inhaler, and you're in the middle of an asthma attack, you might not be able to breathe super deeply. So just do the best that you can, but following these techniques, okay? Remember, when you're doing this, you need to also create a really nice tight seal with your lips around the mouthpiece so that when you're breathing in and out, you're only breathing through the spacer. You are not, the air isn't seeping into your mouth from around the spacer, and also you're not breathing in and out through your nose. So this is what it will look like. You've got your inhaler in the spacer, it's already been shaken. You spray it, and then nice deep breaths. You want to do at least 5 or 6 of these. So you could hear me breathing out and you could hear me breathing in. So you're breathing in and out through your mouth, and then you just repeat the breathing 5 or 6 times. This will hopefully maximize the amount of medication that's going into your lungs and give you the best possible effect. Some people might need to do a second dose, in which case, again, you just shake the whole thing, or you can take the inhaler out, give it a shake, pop it back in, and then spray it, and then breathe in and out 5 or 6 times. Sometimes I recommend 10 times. It all depends on the person. Let me know how you get on. Send this to someone with asthma or COPD or anyone that uses an inhaler. And let me know if you have any questions in the comments below. Thank you.